All right, the scene in Macau, China today, it's the gambling haven of the world, and it's been shut down, or will be, for at least another week right now as COVID cases begin to flare up there. 25 million Shanghai residents, by the way, are separately being asked to be retested to see if things are spreading there as well. And we're seeing limited movement in Hong Kong on the same story. So it's repeating itself in Asia. It's jarring those who thought that at least we were over this. At least there, that is not the case. And there are spikes in cases here as well. Dr. Anthony Fauci knows of what I speak. He had to endure COVID himself and a pretty bad case of it. The White House chief medical advisor joining us now. Doctor, good to have you. How are you feeling?
I'm doing real well, Neil. Thank you for asking. I'm actually fully recovered, and I'm essentially back to normal, thank goodness.
Now, you were, being treated again. Was there a flare-up after the flare-up? What was going on there?
Well, what happened is I was initially infected, and given my age, at being a risk person at my age, I took Paxlovid,
right,
and it successfully diminished the symptoms pretty effectively. And then when I finished the course, I tested myself on a Monday. I was negative, Tuesday negative, Wednesday negative, but then on Thursday, it reverted back to positive. So simultaneously with that, literally within 12 hours, I started to get a return of symptoms with fever, with aches, with, some little bit of a cough, not very bad. So I went back on Paxlovid for another 5 days. That cleared things up very well. And now I've been negative for multiple days since then. So I'm doing very well, thanks.
Let me ask you about this, because when people heard, oh my gosh, this has happened, to Dr. Anthony Fauci, everyone knows someone who's gotten this again, and sometimes again after that, and they're beginning to wonder about the regimen for treating it. Whether you get 2 vaccination shots, whether you get a booster, another booster, they just don't know. What do you tell them?
Well, that's a great question, and thank you for giving me the opportunity to clarify it, Neil. There's no doubt that the vaccines themselves, particularly vaccine plus a booster at the appropriate time when you become eligible for a booster, for more than one booster. If you're over 50 years old, you get eligibility for 2 boosters. One of the things that's clear from the data, that even though vaccines, because of the high degree of transmissibility of this virus, don't protect overly well, as it were, against infection, they protect quite well against severe disease leading to hospitalization and death. And I believe that's the reason, Neil, why at my age, being vaccinated and boosted, even though it didn't protect me against infection, I feel confident that it made a major role in protecting me from progressing to severe disease. And that's very likely why I had a relatively mild course. So my message to people who seem confused because people who are vaccinated get infected, the answer is, if you weren't vaccinated, the likelihood you would have more severe course than you did have when you were vaccinated.
But, there are a lot of people looking at this, especially with this new strain. I can't even keep up with it, doctor, or even know if I'm pronouncing it right, this BA 2.75 or what have you. It always seems to be mutating. It always seems to be spreading. And yet the collective view of the world is we are over this. Time to move on. Time to live our lives. Time to fly again. We're no longer forcing those who are coming in from other countries that they've either been vaccinated or testing negative for the virus itself. So how do you feel about all this?
Well, we are certainly not over it. And I think that, people have an understandable desire to put this in the rearview mirror and say we're through with it. But that's just not the reality, Neil. And when I say that, I don't mean to scare people or to get people feel they have to dramatically alter their lives or do anything with mandating a thing like that. We're not talking about that. We're talking about making use of the available interventions that we have. Let me give you an example. 67% of the people in this country are vaccinated. We rank very low among developed and developing nations in the proportion that are vaccinated. Of those who are vaccinated, only about half of them have gotten their first boost. Again, we've got to do better than that. We're giving the virus the opportunity to continue to spread in our community. And if we do simple things which are not disruptive in any major way, vaccination, boosting, testing. For example, if you're going to go to a function, you want to get tested to make sure you're negative so that if you are infected and you have minimal symptoms, you don't spread it. If you have a vulnerable person in your household, someone who's on chemotherapy or immune compromised, you might want to test regularly to make sure you don't inadvertently bring the virus home to a susceptible person. Those are relatively easy things to do, Neil, and yet we're not doing enough of it. And that's what I'm trying to get the message out. We don't want to disrupt your life. We don't want to force you to do anything, but do some common sense things that have been proven to be effective.
All right, so very quickly then, Doctor, if people are realizing, yes, the number of cases have spiked pretty much across the globe, nothing like what's going on in China, but they're not severe cases. They're very few hospitalization cases, although they're spiking as well. That makes Americans in particular say, been there, done that, over that. What do you tell them?
Well, I tell them it's understandable with that attitude, but be careful. We are still having an increase in hospitalizations. We're having many more infections than being recorded. We say it's about 140,000 a day. Those are grossly undercounted because many people who get infected do a home test and don't report it. And we are still at around 300 deaths per day. That is an unacceptably high level, Neil. So although people kind of say, been there, done that, well, we're at a level that is not an acceptable level for us. We've got to do better than that.
All right. I know this was tough on you because you missed your daughter's wedding, at least to be there in person because of this COVID scare. So I hope everything went okay. You're okay.
Yeah, I'm fine, and thank you for asking, Neil. Really appreciate it.
All right, Dr. Fauci, thank you very, very much.
Hi, everyone. I'm Brian Kilmeade. I want you to do me a favor. I want you to click to subscribe to the Fox News YouTube page. This is the only way that I know for sure that you're not going to miss any great commentary, any great news bites, any great interviews coming your way on Fox. You can get it all here on YouTube. So subscribe right now.